What psychological impact does critical care have? Imagine waking up in a strange, noisy environment, surrounded by machines and unfamiliar faces, feeling helpless and disconnected. Critical care can be a life-saving experience, but it also leaves a deep psychological mark. When someone is admitted to intensive care, they face extreme stressors that can be very traumatic. They often have to endure painful procedures, be on mechanical ventilation, and sometimes cannot communicate their needs. The environment is intense and overwhelming, which can cause feelings of fear, helplessness, and loss of control. Many patients experience episodes of delirium, a state where they are confused, disoriented, and unable to focus. This confusion can be frightening and disorienting, especially when combined with the awareness of being vulnerable and connected to machines. The experience of being restrained to prevent removal of life-supporting tubes can add to the trauma. All these factors create a perfect storm for psychological distress, which can linger long after physical recovery. One of the most common psychological effects after critical care is post-traumatic stress disorder. This condition develops when a person has gone through a life-threatening event and continues to have intrusive memories, nightmares, or flashbacks of that experience. They may also feel hyper-aroused, meaning they are easily startled or constantly on edge, and they might avoid situations or thoughts related to their trauma. Research shows that about 1 in 5 people who survive intensive care develop symptoms of post-traumatic stress disorder. Some studies suggest that up to 1 in 10 critical care patients experience significant symptoms. This highlights that post-CU psychological trauma is quite common and not just a rare occurrence. Early signs of anxiety or stress after leaving the hospital can be warning indicators of developing post-traumatic stress disorder, so healthcare providers need to pay close attention to these symptoms. Recognizing and addressing them early can make a big difference in recovery. Not everyone who goes through critical care will develop psychological issues, but certain factors can increase the risk. For example, experiencing delirium during the ICU stay is linked to higher chances of developing post-traumatic stress disorder. Patients who experience delirium often have more severe psychological symptoms afterward. It's also important to note that the impact extends beyond the patient. Family members who witness their loved ones experiencing delirium or distress often report higher levels of anxiety, depression, and even post-traumatic stress symptoms themselves. This shows that critical care trauma affects the entire support system, not just the individual patient. Beyond post-traumatic stress disorder, survivors of critical illness may face a range of mental health challenges. Anxiety and depression are common and can occur together, creating complex emotional struggles. These psychological issues can interfere with daily life, relationships, and overall well-being. Recognizing that physical survival is only part of the recovery process is crucial. Many healthcare systems now understand that mental health support is essential for full recovery. Patients often need ongoing counseling or therapy to process their experiences and regain a sense of safety and control. Understanding the psychological impact of critical care is vital for improving patient outcomes. Healthcare providers should be aware that psychological distress is a serious concern that requires attention alongside physical health. Early identification of symptoms, understanding risk factors like delirium, and providing appropriate support can help lessen the severity of trauma. Supporting families is equally important, as they often experience their own emotional distress. Providing education and emotional support to loved ones can help them cope and better support the patient's recovery journey. In the end, critical care is a life-saving intervention, but it can also be a profound psychological challenge. Recognizing the potential for trauma and addressing it with compassion and evidence-based strategies can help survivors rebuild their mental health and regain their sense of safety. If you or someone you know has experienced critical illness, it's important to seek professional medical advice for psychological support tailored to individual needs. Remember, recovery is a process that involves both body and mind, and help is available to navigate that journey.